Many Kentuckians, especially seniors, are taking multiple prescription drugs at once, and that can be tricky to manage. We explored those challenges during our special program, Seniors and Medication, a Next Chapter forum that aired on KET. Among the topics, keeping tabs on all your medicine.
Who's responsible for keeping track of all this, Laura? I mean, who's the person that says, okay, I'm the quarterback, or I'm going to watch and see what everybody's taking?
Well, I always like to say that the primary care physician, or whoever that primary care provider is for our patients, is the main person who should be the captain of the ship, so to speak. We always want that captain to be working with the patient. The patient should be their own advocate, too, and they're the best partner with their PCP in this process. That person needs to keep track of that medication list, take it between all the specialists, back to their PCP. If they go to the hospital, to the nursing home, they really have to hold on to and own that medication list. But if you're going to multiple specialists, which is what we see very commonly nowadays as people are aging, developing more chronic conditions, then that primary care provider has to be the one that really coordinates and looks over all of that and really reviews it to try to have that one central review of the medications. And we work with our interdisciplinary team as well to help.
Danesh, if you would put on your anesthesia hat in addition to your wellness hat, how do you see the communication that goes on when patients have multiple drugs, and how does it impact what you're trying to do for somebody?
Well, Wayne, it's you know, I think it's important to look at how we got to this position where we have polypharmacy as a concern. Healthcare has long been focused on acute illnesses. I mean, you know, if we go back like 60, 100 years, what killed people wasn't heart disease, it was infections or injuries. We've gotten really good at treating those acute problems. Now we're dealing with a situation where most people are living longer and overcoming those acute problems, and the problems that they're facing as causing mortality and morbidity or shortening of their life prematurely or lower quality of life are chronic conditions. And so it's easy to get into this routine where we're just chasing our tails trying to treat problems, cure problems, which is more of that short-term or acute problem mindset. And rather than looking at preventative approaches that prevents people from developing into chronic conditions, I think the big thing that I focus on is just that. How do we preserve longevity and how do we preserve quality of life so that we're not having to introduce polypharmacy? Because as the rest of the panel will also agree, it's challenging to manage chronic conditions when we're already dealing with a polypharmacy situation.
So Angela, we have the medications that are being prescribed, but if anybody goes into any pharmacy,
absolutely,
you know, there's this plethora of stuff that's out there.
And yes.
And who's keeping track of that, and what possible impact can this have?
That's so interesting you would say, because I always say if everybody's in charge, then nobody's in charge. And I think we can help our physicians so much from pharmacy perspective in gathering that information, and especially if we can get that all in one place, if a patient, as much as possible, use the same pharmacy and form that relationship with your pharmacist where you are telling them about the herbal supplements that you're taking, telling them about the over-the-counter things that you take, so that we can take all that into account and do what we call a medication reconciliation. And not just when you enter the hospital, we have pharmacy staff as was mentioned that it's an interdisciplinary approach where we look at everything that you're taking, and unfortunately people get that mixed up. They are told to discontinue something and start another medication, but they end up with both. They may be taking duplicate therapy, things where they have different names, Toprol and Lopressor. We've seen people come into the hospital and be on both of those. They're the same generic name. They're both metoprolol, but the patient misunderstood and ended up on both of them, slowed their heart rate. That's what brought them into the hospital in the first place. So we see that. We see duplicates of therapy. We see drug-drug interactions, as you mentioned before, and all that can be brought in. And along with that, just pleading with folks to tell all your healthcare providers about all the medicines you're taking, and please consider over-the-counter medicines and herbals as medicines. And just because it's herbal and from a natural source doesn't mean that it can't hurt you, because it can. They can interact with your prescription meds. They can send out a red herring, basically, where something is a side effect of a medicine, but it really it was not seen as such. So we all have to take responsibility for that, including the patient.
A lot of great information in that program that you can see the entirety of, Seniors and Medication, a Next Chapter form. It's available online on demand at KET.org. And watch Kentucky Health with Dr. Wayne Tuckson Sunday afternoons at 1:30 Eastern, 12:30 Central, right here on KET.